This is a brief primer on one of our latest practice guidelines on trauma-informed care, workplace, and practice. This primer was created to summarize the contents of the practice guideline and to introduce its contents and tools. We encourage you to go to the webpage located at the bottom of the screen and take a look at the practice guideline for yourself. You can learn more in-depth knowledge on trauma-informed care, as well as access digital copies of the practice guideline and quick guide illustrated in this video.
First, why do we need a trauma-informed care workplace and practice guideline? With Behavioral Health Services, BHS, working toward becoming a trauma-informed care system, the need for a practice guideline was identified. BHS has provided several trainings for clinical providers. The Trauma-Informed Care Workgroup has developed several initiatives and workgroups toward moving BHS in a trauma-informed direction. The inception of this practice guideline is timely in aligning with the efforts already in progress and summarizes the collective approach BHS is taking with becoming trauma-informed. This practice guideline gives us something tangible for all BHS staff to be able to use and reference in order to implement a trauma-informed workplace and practice.
As part of the development of this guideline, we consulted the most current research available on the subject. There are multiple benefits for our clients and our workforce that justify implementing a trauma-informed system of care. First, there's evidence that trauma-informed services lead to better clinical outcomes, including a reduction in client psychiatric symptoms and substance use, and improved psychological resilience, for example, improved self-esteem and healthy relationships. Trauma-informed care establishes a platform for survivors to rebuild a sense of control and empowerment, as well as recognizes the effects of secondary trauma and supports self-care in the workforce. Providers also report greater collaboration with clients, enhanced skills, and support from agencies. There's also evidence that professional training in trauma-informed care improves compassion satisfaction or the perceived self-efficacy related to providing care to others. Additionally, the use of evidence-based practices lowers compassion fatigue and burnout among trauma therapists. And finally, trauma-informed care is cost-effective as service costs are proportional to how we practice and promotes workforce retention.
Let's look at some of the recent statistics on trauma and its impact on our clients. Studies show as high as 90% of adults and over 60% of youth in the U.S. having experienced at least one traumatic event. Exposure to traumatic events is even higher among those receiving behavioral health services. For example, 84% of psychiatric inpatients have experienced at least one traumatic event, up to 94% of outpatient mental health clients report a trauma history, and 60 to 90% of treatment-seeking substance abusers report a history of sexual or physical abuse. Those who had childhood experiences of trauma are up to 5,000% more likely to attempt suicide, use intravenous drugs, or develop an eating disorder. Lastly, up to 70% of social workers identified experiencing at least one symptom of secondary trauma, and up to 15% reported symptoms consistent with PTSD.
How was the practice guideline created? This practice guideline was developed in collaboration and consultation with all BHS service areas, county and contracted, and is inclusive of all staff levels. The Trauma-Informed Care Workgroup was also involved in providing input, review, and solicitation of feedback from providers as the guideline was being developed to ensure alignment with best practices and workgroup initiatives. The practice guideline also relied upon information provided by the Substance Abuse and Mental Health Services Administration, SAMHSA, and the British Columbia Trauma-Informed Practice Guideline, the BC TIP Guide. You can also learn more about the Practice Guideline Workgroup as well as the workgroup's process on the BHS Practice Guidelines website at the URL listed.
Overall, what is the purpose of the practice guideline? This practice guideline is intended for all levels of staff within BHS to gain a common understanding of the foundational principles of trauma-informed care and workplace. This guideline aims to promote work environments that are trauma-aware and safe, foster resilience, and actively mitigate the potential negative impacts of providing services to those who have experienced trauma. Trauma-informed practice is an overall way of working rather than a specific set of techniques or strategies.
This practice guideline delves into the following foundational principles. First, cultivating trauma awareness, which helps us recognize trauma. Second, promoting an atmosphere of safety and trustworthiness. Third, using a strengths-based approach to promote choice and empowerment. Fourth, promoting collaboration, connection, and peer support to foster connection across everyone involved. And last, recognizing cultural, historical, and gender issues. Let's look at some of the ways these principles can impact our provision of services.
First, acknowledging our own understanding at a personal level, then applying this at a practice level when working with clients and colleagues. Next, when interacting with others, making sure our approach is engaging. Asking about trauma in a trauma-informed way, that is, responsive to the client's needs and presentation while enhancing their sense of safety. Also, the use of trauma screening tools can help us identify trauma earlier and more accurately. Additionally, making links with trauma helps to bridge the gap between the past and the present and helps clients make valued strides in their future decisions. Lastly, we can help with this task with skill building and empowerment, which can help clients build their capacity and confidence when dealing with their trauma. Resources and guidance about implementing trauma-informed care with special populations and settings, including experiencing trauma in the workplace, are also included in the practice guideline.
Visit the Practice Guidelines webpage by navigating to the ochealthinfo.com webpage, hover your mouse over About HCA, and select Behavioral Health Services. Once there, hover your mouse over For Providers and select BHS Practice Guidelines. On this webpage, you can view all the created and adopted practice guidelines currently in effect for behavioral health services.
Here is where you can find the practice guideline to view for yourself. We encourage you to take the time to read its contents and discuss with your colleagues and supervisor about ways you can implement these guidelines in your workplace and practice. In addition to the practice guideline itself, we have also developed a practical and easy-to-use quick guide that BHS staff of all levels can utilize. As you can see, the quick guide includes information on how to define trauma, work with individuals who have experienced trauma, ways to engage in self-care for staff, ideas on how to promote a trauma-informed workplace, and a personal preparation plan. This concludes our introduction to the Trauma-Informed Care and Workplace Practice Guideline.